I'm Ashley Kilgore, and I'm here today to introduce Priscilla Jadala, and she focuses on the population affected with eating disorders. Priscilla, why don't you tell us a little bit about yourself?
Well, I've been working in the field of eating disorders for about 5 years now, and I recently graduated in October with my master's in marriage family therapy.
Okay.
And now I'm just embarking on the journey of opening a private practice under supervision in South Orange County.
Okay, great. And what has your experience been with eating disorders?
I've worked in 3 different residential treatment facilities, as well as, attended conferences focused on eating disorders. And, you see so many different things. I've worked with adolescents as young as 10 years old.
Mm-hmm.
I've also worked with the older population. And, you see, I guess, the wide spectrum of age that people are affected with eating disorders, male and female. And you learn a lot in the residential treatment centers. A lot of them are similar and a lot of them are different. So I feel working in 3 different ones really gave me an advantage of what works and maybe what doesn't work as well.
Wow, that's quite a bit of experience working in 3 different residential places. How would you define eating disorders for those of you out there that aren't really sure what is an eating disorder? What types are there? What does that mean?
Yeah, to briefly explain the different types of eating disorders and what they are, there's anorexia, which there are 2 types. There's the restricting type, which is, basically a fear of taking in a lot of food, very minimal. I mean, you could have someone who only eats probably 100 calories to 500 calories a day.
Wow.
And then you'll also have the purging type, who they are categorized as anorexic because they fall under the BMI scale, but they are actually purging whatever food they do eat.
What is the BMI scale, just for anybody that's not sure what that is?
The body mass index scale, and that means that to be diagnosed anorexic, you have to be below 85%. And so that will categorize them in the anorexic category, and then you go into the bulimia, which actually can just be either through purging and through over-exercising, laxative abuse. And it's basically you go through a binge where you eat an excessive amount of food in one sitting, and then you alleviate that through purging, over-exercising, or laxative abuse. So they don't meet the criteria of anorexia because they don't fall under the body mass index scale.
Okay.
And then there's also binge eating, which is basically overeating uncontrollably, but there is no expelling behavior as restricting or purging through any other method.
How would you define purging for anybody that doesn't know? Like, what does that mean? Like, restricting obviously means restricted, like not allowing, but what is purging?
Purging basically means it can be done in many different ways. So you can force yourself to throw up with, there's different ways that people will utilize that. They can also purge through laxatives. So you can actually also purge through exercise as well. So exercising to basically burn off what you've eaten for the day, or even double, triple that. And so basically they'll eat and then they'll panic, and then they need to get rid of it in any sort of behavior of what I just listed.
What sort of, you mentioned that you've worked with a lot of different populations. Is there any particular age range that you see eating disorder more commonly, or it can really occur at any age?
It can really occur at any age. It does tend to happen at a younger age. I worked in an adolescent treatment center, and I saw kids as young as 10 years old coming in. And that was pretty shocking for me. I didn't realize that kids that young were being affected and worrying about what calories they'd eaten or what their weight looked like. And that was kind of eye-opening for me. But then again, like I said, you also have people who've suffered with it all their lives, and they'll come into treatment 40, 50, 60, married with kids, still debilitated by this disorder.
Wow. And what about male, female? What's the ratio for, like, just in your experience that you've seen?
I mean, what I see in the homes that I've worked at was predominantly female, but I feel that there are many men. I've seen males that have come into treatment. There are many men out there who do suffer from eating disorders, especially related to sports like wrestling or having to be under a weight category. That's kind of how it develops. And the only difference is men, I think, feel more shame or not able to have the ability to kind of reach out for help, so they are actually less likely to go and seek treatment, which is why you actually don't see a lot of males in treatment.
Yeah.
But they are out there suffering as much as a lot of the women are.
Why do you think there's more, you mentioned shame in regard to males having eating disorders?
I think it's because, women, I guess, are in some ways expected to care about how they look, their bodies, how they present themselves. And with men, I think it's kind of a foreign concept that a man would want to be under a certain weight or even be severely skinny. We picture men as big and muscular and strong. And the idea, I guess, of them really worried about weight to the point where they would be sick of this disorder is kind of a new revelation in the world.
You mentioned that being skinny, that kind of makes me think in my head when you were saying that. Do people with eating disorders always have to be really skinny? Like, is it whenever you see somebody really skinny, it's like, oh, they must have an eating disorder? Or can people look normal and have an eating disorder?
Yeah, it's a funny misconception because a lot of people who do suffer from eating disorders, you might not notice it right away, especially if they are bulimic or binge eaters or even orthorexic, different types of things that are coming out now. They will look very normal. They will look a normal, healthy weight. And that's why a lot of it is done in secret and in hiding. And unless you kind of catch them in the act per se, more so with bulimia, I think in binge eating, you really won't know that it's going on.
Wow.
With someone who's suffering from anorexia, I think it's a little bit easier to tell because they do become emaciatingly skinny, but with binge eating or bulimia, it's a little harder to kind of really see the signs.
Okay, that's good to know because there are misconceptions out there, so you never know, how you can kind of tell, per se.
Yeah.
What would be some warning signs that maybe you could tell people out there if you saw these warning signs that this person might have an eating disorder?
I think the things that to pay attention for, especially even with your teenagers and at a younger age, is a preoccupation with their body to the point where it's causing them distress. A preoccupation with food, if they seem fearful or timid around certain foods, that's beyond, I think, a normal concern. I feel just, preoccupation with the media and society and what images they're seeing and how it's affecting them, what they're hearing from their friends. I've noticed a lot of people who've come into treatment at a younger age, they say that they were triggered by something a friend had said or being made fun of, which can account to the rate of bullying that's happening nowadays, that we kind of don't even associate that these things could be a precursor to other disorders. So I think just paying attention to the signs, even over-exercising, baggy clothes to hide weight, I think just being aware of what a person is doing and how they behave, you can kind of, see certain signs. But it's different for everybody.
Yeah. What kind of treatments would you say are effective for treating eating disorders? Because you mentioned you worked in several residential. Is that the best treatment, or just in your experience, how does it work?
Yeah. I think residential is definitely a great resource that is out there today. It's definitely, for someone who is so sick in their disorder that they cannot handle everyday life, or their health has deteriorated so bad that they need immediate attention. The only issue with residential as far as treatment goes is that they are under insurance guidelines. So their main focus is getting you up to a weight category and stabilizing your weight, and that's a lot of food focus. So they do try to treat the underlying issues, but they don't have much time because they are under insurance guidelines. So I feel if you do see the signs out there and you are seeing someone who's struggling, getting them into therapy and having them work with a well-trained therapist will actually help hopefully make it so they don't have to go to residential treatment.
That makes
centers.
sense. Okay. What has been the treatment that you use in therapy with eating disorders? What do you do when you have someone that comes in that has an eating disorder?
I like to combine different modalities. From what I've seen, what really works well is a combination of cognitive behavioral therapy, which is, kind of talking with patients and clients and seeing, how are your thoughts about yourself, your image, your self-worth, self-esteem affecting your behaviors through food, through how you react to certain situations, to your triggers. And then combining that with dialectical behavioral therapy, which is teaching them a lot of mindfulness skills, a lot of radical acceptance, distress tolerance when they are triggered, how to kind of scale down and not go straight for their go-to coping mechanism, which is eating disordered behavior. And I think giving them coping skills, art therapy, equine therapy, relaxation techniques, mindfulness, I believe is huge. And also food education. I think, they're so fixated on food being bad or scary that if we can educate them to kind of take control to, feel good about what they're putting into their body and learn how it actually works in conjunction with their body, that it usually helps very well with patients.
Okay. And you mentioned to me earlier that you were starting a group Tell me a little bit more about your group.
Yeah, we are. I'm actually starting a group in Dana Point for eating disorder recovery and support. And the great thing about this group is it's going to be very curriculum based. So you'll know what we're gonna talk about, what we're gonna discuss, what you're gonna learn when you come in. We're also gonna have slots for about 6-7 people, so it's gonna be the same faces, so you're comfortable with everyone that's around you. You actually get to know each other, and it's just gonna be a place where you actually have continued support outside of the group. And we're gonna have guest speakers and people who are gonna come in and teach you different things that will help you in your recovery.
That's great.
Yeah.
How can people get in contact with you if they're interested in attending your group or maybe seeing you as a therapist?
Yeah, you can actually contact me. My website is www.journeytobecomingwhole, as well as on Facebook under Priscilla Jadala, IMFT. And you can also find me on Twitter as Journey to Become, and on LinkedIn under my name, Priscilla Jadala.
Okay, Priscilla, do you have any lasting message that you'd like to send to anybody out there that maybe is struggling with an eating disorder? Anything you'd want to tell them? Or
Yeah, I guess I would want to share with everybody out there who may be struggling, who knows someone that's struggling, that recovery is possible, and all you need is to take that first step to reach out to either get someone help or get the help yourself. And hopefully I can work with you to get you through your recovery and achieve long-lasting results.
all right, thank you for coming in and talking to us about eating disorders today.
Thank you.